Hi, it's Isabella. I've worked with children using play therapy, and in my experience, although desirable, a fully equipped playroom is not essential for children to express themselves. There is always a place for therapy. If you have a place for an adult to sit on a chair, then you have a place for play therapy. There's no excuse. It can be done in a corner of an unused classroom. It can be done in a tiny cubbyhole for an office. It can be done in a broom closet. Sturdy shelves make a great place for children who wants to hide or are feeling small and are feeling vulnerable. In these modified settings, the therapist can keep a selection of toys stored in a box or in a tote bag or in a closet, and they can be laid out on the floor, on a desk or on a chair just before each play therapy session. Play therapy does not work well outside because there are too many distractions, especially for younger children. You cannot accomplish as much out there as you can in a room that provides privacy. Carpeting should also be avoided because it's difficult to keep clean, almost impossible to sweep sand out of, and spilled paint make real mess. Where carpeting cannot be avoided, like my play area for today, a large sheet of vinyl can be placed over the carpeting, which I don't have right now, so please excuse me. However, this may also convey to children that they should be careful and clean. A general guideline I follow is that the play area should communicate the message, be yourself in play. This is immediately therapeutic as a child is being allowed to set directions and assume responsibility for doing so. What is important is that children can be provided with an opportunity to choose the mode of communication that is most natural for them. An important rule of thumb, toys should be carefully selected, not collected, because toys are the child's words. And not all toys provide an opportunity to express self, desires, experiences, their wishes. It must be age appropriate, non-mechanical, non-complex, that they should be able to manipulate themselves. It should also be culturally sensitive. If possible, toys should include dolls with different skin tones, ethnic play foods, and other toys that symbolize their own experiences. Real-life toys can be anything from dolls and bendable family figures like this that represent a family, a father, a mother, siblings, and grandparents. A bendable Gumby, which I don't have right now, but this one I made out of a clay, is a humanoid clay figure that is colored green, which is racially neutral and a symbol of life. Can be a mother, can be a father, sister, brother, perpetrator, and can be anyone. A dollhouse with furnitures that show the bedroom, living room, kitchen, and bathroom can be used as an assessment tool for identifying family dynamics, patterns of interaction, communication that a child can live out through play. If you don't have a dollhouse, you can use a small cardboard box with rooms marked on the bottom, cut a door on one side, a window on the other side. It also serves as a storage container for toys. Other real-life toys include play foods. Again, they should be ethnically sensitive. Cups, plates, spoons, teapot, nursing bottles. If you're using a real nursing bottle, please get a ton of nipples, extra nipples, because children love to suck on them. Pacifier, baby food items, and a baby's cleaning bathtub. Because a child who did not receive the tender, loving care they needed may also play out nurturing themes with toys, and this can signal a way that they try to nurture themselves by providing the affection and safe care giving they need. Because real-life experiences are what lead to the need for play therapy, a medical kit that a child can use to develop a feeling of control in life situations promotes inner balance in the child. A small car can be a family car, police car, can be a fire truck, and can be an excuse for moving about. Play coins, costume jewelry are especially important for the shy, anxious, or withdrawn child because they can be played in non-committal ways without revealing any feelings.
When children are ready, they will choose play media that will help express their feelings more fully and openly. A Lone Ranger type mask can facilitate a quick identity change. Immediately, they are somebody else. These are acting out or aggressive release toys. Rule of thumb, there should be something in every play setting that a child can destroy. Some children don't feel complete about coloring about it or shooting a dart gun. These cartons serve that purpose because they can be smashed, they can be ripped, torn apart, stabbed into holes, or painted. Almost anything that a child wants to do, what you need to set a limit on. It's understandable why some parents won't allow dart guns. But children create weapons anyway, and they use their fingers and say, bang, 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 or use sticks to pretend it's a weapon that they've seen on TV. So what I would do is say to the parent that this is an opportunity for their child to learn an important lesson, which is people are not for shooting. Shooting is for the walls. Other toys that facilitate aggression are sticks for grabbing, for throwing, and for burying in the sand. A rope for tying, and a Nerf ball that doesn't bounce as much as a rubber ball. Animal toys that represent animals should be included because younger children find it difficult to express aggressive feelings even against human doll figures. Some children will express hostility through a tiger or through a snake or centipede. Play-Doh fits two categories as it is both creative and aggressive. It can be pounded, smashed, rolled over with vigor, and pinched into pieces as a way to express anger or frustration. At the end of the session, you should always offer the child an opportunity to undo what they have done. For example, you can say, Jacob, the rope is still on my wrists. It provides the child to freely undo. If they won't undo it, I'll take them off without saying a word. Toys for creative expression and emotional release. These are art supply toys that encourage creative or artistic expression. These include anything that can be used in an artistic medium such as paint, Play-Doh, which I take one can out at a time because some children don't like them mixed. You see? They get mixed up. Scotch tape, washable glue, colored pens, a box of crayons would be quite sufficient. 8 crayons would be quite sufficient, or 10. Too many colors can be overwhelming for some children. I prefer to break them because I'd like to convey the message that in here you don't have to be neat. Some rooms may not be appropriate for messier items like paints or colored or sand glue, colored sand or glitter glue. Like I said earlier, avoid carpeting. That would preclude a child from creative and emotional release. Paints afford the child an opportunity to be creative, to be messy, to pretend bathroom scenes and smear and express feelings. Many children in need of play therapy have poor self-images, so providing these toys and materials are necessary for building up a feeling of, in here, I can do things for myself, I can be successful. For children who are musically inclined, of course, music can always be a source of healing and expression and creativity. Other toys are hand puppets that provide a safe way to express feelings without being threatened, because the characters of the puppets are the ones expressing the feelings. Sexually abused children will often use aggressive hand puppets like alligator, wolf, or dragon, tiger, shark. A sand tray that includes miniature toys such as dinosaurs, tigers, spiders, snakes, rats, or sharks, and a rescue team and a block that can serve as a place for haven or respite or rescue, help add reaction and expression symbolically to those who have experienced trauma. Blocks can be houses that can be thrown or stacked and kicked down, allowing the child what being constructive and destructive feels like. It's a nonverbal therapeutic intervention that can facilitate a child to choose from a collection of miniatures and build a small world in the tray that reflects what is going on in their lives. The therapist observes the choice and arrangement of toys without interruption, allowing the child to find resolutions within themselves. And although sand play is especially well suited for working with younger children who often cannot express their feelings in words, it is also a technique that is helpful for some teens and adults who are having trouble expressing themselves and who may have suffered some form of severe emotional wounds. Lastly, if you have a playroom, the toys should be cleaned up and toys put back in their proper place by the therapist after each session. Because toys are the child's words, the child should not have to go searching for the toys for expression, and the playroom should present an image of order and consistency. These dimensions are therapeutic. And for those that use the tote bag playroom, you can store the toys again in the tote bag in a corner of the room.
Why wouldn't I ask a child to do the cleaning up after a session? Because I wouldn't ask a child to do something that I wouldn't ask an adult to do. Picture this: Mrs. Cruz is in your office, her husband left her, all the money's gone, she doesn't know where the next meal is coming from, and she's all bitter tears. She's used up half of the box of your tissue Kleenex, of your Kleenex, and some of them are on the floor, some of them have found their way in the trash can, and some of them are on the table. And then you say to Mrs. Cruz, our time is up, but before you leave, please clean up. How would you feel? Or picture Jacob, who never puts away anything in his life. By the 5th session, when you say, Jacob, we have five more minutes before it's time to go, which we, usually, which is a warning that we usually give at the end of every session, and he starts cleaning up. So which is more important, that he puts away the toys because you told him to put it away, or that he put it away because he chose to do so? Obviously, the second one is a more powerful dimension. What would you do if you were dealing with a compulsively neat child? He is Mr. Clean, Mr. Neat freak, who never left out anything in his whole 6 years of life. And he leaves this little red car in the middle of the room. Would you ask him, Chris, before you leave, please put back the red car? Because that is progress for the child. I would just let the child regress to the me naturally on the issue of cleaning up. Thank you, folks, for listening, and hope you learned something new from my Play Therapy Kit presentation.